Hey, future medics, Tina here, your medic mentor, and today we're talking about a medication you might run into with a patient that is experiencing a psychiatric emergency. It's haloperidol, better known by the brand name of Haldol. Now, Haldol is an antipsychotic, and it works by blocking dopamine receptors. Now, dopamine is an important chemical mediator when it comes to emotions and mood. And in certain psychiatric events, especially psychiatric emergencies, we can see certain neural pathways flooded by an excess amount of dopamine. And this can lead to psychosis, agitation, or extremely violent behavior. By blocking the dopamine receptors, we block the brain from that barrage of excess dopamine, which helps calm the patient down to keep them safe. The dose for adults is 5 to 10 milligrams IM. It's rare that you're going to see this one IV because it holds several risk factors for heart dysrhythmias, but IM works perfectly. The onset's a little slow though. It's 10 to 30 minutes, which is why in EMS you'll see our front line for agitated patients is a benzodiazepine rather than haloperidol, just because it takes so long to work. The trade-off though is it lasts for hours, which is great if you need a patient, keep a patient calm on a long transport. Side effects for this one include sedation, which we planned on, just monitor their breathing really well. But also hypotension, and the big one that we watch for is extrapyramidal symptoms. And that looks like muscle tremors, rigidity, and strange posturing. It's not super common with one dose, but it is something to be aware of and pay attention for. Now, for contraindications, we're going to avoid this in anyone with Parkinson's, seizure disorders, or who already has a prolonged QT interval. Also, anyone who is already hypotensive, probably not going to be safe for them, or anyone who is already CNS depressed, we're not going to give this to them either. Here's your takeaway. Haldol is perfect for your psychiatric patients. It works well by calming down the excess dopamine in the brain. It does have a long onset, and it does have some side effects that you're going to need to keep an eye on. As long as you're monitoring your patient closely, all should be well. That's another one knocked out. You're doing so great in this series. I'll see you for the next one.